Nesirated B-type natriuretic peptide has been demonstrated in several studies to provide a renoprotective benefit when used during surgery, primarily in patients with abnormal renal function, but also in patients with impaired left ventricular function and those undergoing high-risk surgery. It dilates the renal afferent arterioles and, to a lesser extent, the efferent arterioles, leading to augmented glomerular filtration. During periods of neurohormonal activation, such as cardiopulmonary bypass, it inhibits the renin-angiotensin-aldosterone axis and has a direct tubular effect on sodium and water handling. Thus, it exhibits strong natriuretic and diuretic properties. Preliminary experience with human atrial natriuretic peptide in patients with left ventricular dysfunction undergoing coronary artery bypass grafting has shown that it provides a similar renoprotective benefit. A. Indications. Nesirated should be considered in patients considered at medium to high risk for the development of postoperative renal failure using the risk algorithms noted in figure 12.1, 12.4. It is usually given to any patient with a serum creatinine level more than 1.4 mg deciliter or a glomerular filtration rate below 60 ml minute, 1.73 meter square. Dosage. It is given in a bolus dose of 2 mg kilogram over 1 minute prior to going on bypass, followed by an infusion of 0.01 0.03 milligram kilogram minutes. The infusion is usually continued for 18 to 24 hours after surgery, but may be given for a longer period if indicated. Occasionally, the diuretic response is so dramatic that it needs to be stopped sooner. The dose of atrial natriuretic peptide is 0.02 nanogram kilogram minute. 6. Phenol-dopam. Phenol-dopam is a selective agonist of the dopamine first receptor that produces a dose-dependent increase in renal plasma flow with a decrease in renal vascular resistance and maintenance of glomerular filtration rate. It increases blood flow to both the renal cortex and medulla and inhibits tubular reabsorption of sodium. Thus, it produces diuresis, natriuresis, and kaliuresis. Studies have shown preservation of renal function and, in fact, some improvement in serum creatinine and creatinine clearance after cardiopulmonary bypass in patients with an elevated creatinine. A reduction in mortality and the need for renal replacement therapy have also been documented. Indications. Phenol-dopam is an alternative to nesirated to provide renal protection during surgery performed on cardiopulmonary bypass. Dosage. It is started as an infusion of 0.1 milligram kilogram minute before cardiopulmonary bypass and continued in the ICU for about 12-24 hours. A dose-dependent increase in renal blood flow is noted in doses up to 0.3 nanogram kilogram minute, but doses greater than 0.1 nanogram kilogram minute are associated with systemic vasodilation. 7. Sodium bicarbonate. Sodium bicarbonate may be an inexpensive means of preventing renal dysfunction after surgery. One report found the following dosing regimen reduced the risk of acute kidney injury after surgery. A bicarbonate load of 0.5 millimole kilogram in 250 milliliter dextrose after the induction of anesthesia, followed by a 0.15 millimole kilogram hour infusion over 24 hours for a total dose of approximately 4 millimole kilogram. Diltiazem has been evaluated as a means of preserving renal function, but its benefits are controversial. It reduces renal vascular resistance by dilating afferent arterioles, resulting in an increase in renal blood flow and glomerular filtration rate. It may limit calcium influx into renal tubular cells, preserving their integrity. It has been shown to increase sodium excretion and improve creatinine and free water clearance by a direct effect on tubular reabsorption. There have been concerns that diltiazem could adversely affect renal function because of its vasodilatory effect during pump. However, further investigation has shown that diltiazem is more likely to improve rather than reduce glomerular function in patients with mild to moderate renal dysfunction. This is significant finding that should not dissuade the use of diltiazem for vasospasm prophylaxis when radial artery grafting is performed. Nonetheless, either nesiritit or phenol-dopam should be used preventionally to provide renal protection. Dosage for diltiazem: 0.1 mg kilogram bolus followed by an infusion of 2 nanogram kilogram minute. 9. Medications often used during surgery with minimal renal protective benefit. Mannitol is commonly added to the pump to increase tubular flow and produce a diuresis. It increases oncotic pressure, reduces tissue edema, and may reduce cell swelling after cardioplegic arrest. Usually 25 to 50 gram is added to the pump prime. However, mannitol has not been demonstrated to provide any benefit to renal function in patients with normal or abnormal preoperative renal function. B. Furosemide. Furosemide is often given during surgery to augment urine output and is beneficial in patients with significant volume overload, severe oliguria, or hyperkalemia. However, its use may be associated with an increase rather than a decreased risk of renal impairment even in patients with normal preoperative function. Thus, although it will increase urine output, it is not renoprotective and should be used only for the indications listed. C. Dopamine. Dopamine acts on dopamine A1 and DA2 receptors as well as alpha-1 receptors in the kidney, whereas dopamine agonist 1 receptors reduce renal vascular resistance. The other receptors oppose this effect, potentially decreasing renal blood flow and glomerular filtration rate. Use of renal dose dopamine 2 to 3 mg kilogram minute during surgery may improve urine output, but has been shown to produce early renal tubular damage equal to or worse than noted in control patients. Numerous studies have failed to demonstrate any renoprotective effect of dopamine during surgery in patients with both normal and abnormal renal function. One study comparing phenol-dopam 0.05 nanogram kilogram minute with dopamine found a comparable lack of benefit in preventing postoperative acute kidney injury.